Good afternoon, everyone. A very warm welcome to everyone who's on the session today. Thank you for coming in for the cancer awareness session, which is led by Dr. Madhu Devarasetty. Before we start off, I would like to formally introduce the doctor to you, and then we will set the stage for the doctor to come in and give his presentation. Dr. Madhu Devarasetty is a surgical oncologist and robotic surgeon in KIMS Hospitals, Hyderabad, and has an overall experience of 14 years in the field. Dr. Madhu Devarasetty also practices at Uma Cancer Foundation in Himayatnagar. He completed his MCA at Surgical Oncology from Usmania Medical College in 2012, MBBS from Usmania Medical College, Hyderabad in 2001, and is an MS General Surgery from Gandhi Medical College, Hyderabad. He is a member of the Indian Medical Association, IMA, Association of Surgeons of India, and Association of Minimal Access Surgeons of India. So we have an amazing doctor today to take us through the presentation and tell us and give us some awareness about cancer and everything else. So Dr. Madhu Devarasetty, very good afternoon, and thank you so much for coming in. We are very, very pleased to have you today.
Thank you. Today being the World Cancer Day, February 4th, it's a responsibility actually. It's not pleasure, it's a responsibility for me to spread the cancer awareness in the society, and each and every educated person, and not even educated people, and uneducated people also should know the details of the cancer, how it occurs, what are the symptoms, what are all the risk factors involved, and how these cancers can be prevented. This knowledge is important for each and every Indian, and I really have to say that each doctor or healthcare professional, people from hospital owners, government, all these people should get involved in spreading the awareness on cancer in general public, so that the appropriate treatment they can take, and they can avail proper facilities to detect early, and the outcomes are going to be good. So the main agenda for creating cancer awareness is for detection of the cancer early. We can't make the incidence zero in India. That's not possible. So what's our job is to bring down the incidence of the cancer and detect it early, so that the survival of the patients after the treatment will be good and their families will be happy. Slide. So in India, the incidence of cancer is rising rapidly, which can be considered alarming situation. There are many causes, actually, not only the lifestyle of the society, conditions in India, especially conditions in India, neglecting the farmers, and concepts like food adulteration, pollution, and unawareness regarding the cancer. All these are playing crucial role in India, that is causing the rapid increase in incidence. So it is our collective responsibility as healthcare personnel to frame policies and programs to improve this knowledge. So objectives of this cancer awareness is to remove the stigma. Most of the patients, once they are diagnosed with cancer, they think that they are dying. That stigma and fear should be removed, and recognition of the cancers early by identifying the signs and symptoms, so that they can get treated at an early stage, and education of people about all these risk factors so that they can modify the risk factors which are modifiable, bringing down the incidence of the cancer to at least 30%. So, how they can modify these risk factors? They should be educated through different kind of platforms. It can be online, it can be through books, it can be through teaching, it can be through camps. So inform people about regular screening camps and checkups. And most of the doctors in various hospitals are conducting awareness walks. These are helping in creating awareness when they are projected through the media regarding what actions have to be taken by the society to prevent the cancer. And all women should be informed about certain basic modalities like mammogram, taking mammogram, it's an X-ray, which will be taken for a woman, especially to identify the breast cancer. Most of the women who undergo mammograms will be advising from 40 years. From the age of 40 years, mammogram is recommended for each and every woman, and they have to undergo yearly once. This clinical breast examination by the concerned physician or whoever is approachable to the woman, they can get it done once in 3 months. This I am going to again repeat. This breast self-examination, clinical breast examination, mammograms. All these three are vital in bringing down the incidence of breast cancer. Similarly, to bring down the incidence of uterine and cervical cancer, this pap smear is going to help. And what the ICS that I mentioned here is the Indian Cancer Society. It is playing very key role in developing the awareness in the public and emphasizing the importance of early detection. It is going to play a major role in the outcomes of the treatment of the cancer. So before going to know what are the symptoms of a particular cancer, how screening is being conducted, and knowledge about all the investigations, treatment of different cancers, we should know what is actually the cancer, how it develops, and what is actually the initiation of cancer, and how it is going to grow. This cancer is the anomalous development or anomalous division of a cell in our body in an uncontrolled fashion that is going to transform into a different anatomical configurations like a lump or an ulcer, whatever it is. So basic initiation here is the mutation, which brings changes in the cell that leads to the development of these cancers. And it has some unique qualities, like it will grow at a particular part of the body, and it can flow through some vessels, and it can survive in the other part also. That is called disease spread, cancer spread, which we scientifically call it as metastatic spread. This is the peculiar quality of cancer, which is dangerous for a particular patient if it develops. For example, melanoma cells in a left upper limb can go to the brain, can go to the liver through blood vessels. This is how a cancer can spread from one organ to the other organ, which we consider it as a metastatic disease. Especially patients with this kind of metastatic disease, it is very difficult to treat them. Their outcomes are going to be poor. So what we have to do is we have to identify it early. This is how a cell in a normal tissue proliferates, multiplies continuously, and becomes cancer at the last. So these are the stages of the cancer, how it is going to, a normal cell is going to develop into a cancerous cell. Just a brief picture, similar thing is being explained this way: the normal cell division and a cancer cell division. We can see the number of cells in a cancerous tumor, how much rapidly it proliferates. What is the significance here is the time. The moment a patient is diagnosed with a cancer, they have to take actions early. They can't drag the situation, they can't drag the problem over days together or weeks together, because the cells are not going to keep quiet. They will be constantly multiplying, contributing to the growth of the tumor. Suppose the growth is confined, the tumor is harmless. That is called as a benign tumor. That's the confined growth, where actually the cells won't go beyond that boundary. That is called a benign tumor. Whereas in the case of a malignant tumor, the cells grow beyond the boundary and invade the neighboring tissues, entering into the all streams and spreading to different sites. So this explains the nature of the cancer. These are certain terms, scientific terms. It's for only basic knowledge. Most of the times you will be seeing some biopsy reports showing this terminology like adeno, chondro, erythro, hemangio, like that. So actually that signifies from which organ that particular tumor is arising. So this is a basic knowledge. If you have that, you will have some idea. And now how the cancer develops, how it is, what's its nature, we have discussed. We should know certain overall basic symptoms. Overall symptoms of cancer. That means cancer occurs in different organs, right from head and neck to thoracic organs, abdominal and gynec, everywhere. And certain basic streamline of symptoms have been mentioned here. This doesn't contribute to the entire symptoms, but it's just a brief introduction. Like any change in the bowel habit, that can be constipation altered with diarrhea or repeated constipation, we should be very cautious. And bladder habit. Bladder habit means if they notice any blood in the urine, or if the urine stream is slow, the particular patient has to approach the corresponding physician. And in the case of an oral cavity, a sore is there, ulcer is there, which is not healing. Which is not healing since 1 month. After repeated treatments, the patient has to take care, approach the corresponding physician for the further evaluation and what kind of treatment is needed. These are little bit cautious signs. We need to be very careful, and immediate consultation is needed with the nearby physician and take appropriate evaluation. And unusual bleeding. Basically, unusual bleeding means bleeding from vagina. Bleeding per vagina or bleeding per rectum also, we should have significance. Everything is significant here, nothing is insignificant. We need evaluation. Suppose if there is a bleeding per vagina, that particular patient should approach nearby gynecologist or a gynec oncologist and take appropriate treatment. Any lump in the breast, any tumor in the breast or any other part of the body have to be evaluated. Suppose if the patient is having difficulty in swallowing, either for liquids or solids, it's very important that particular patient should approach nearby gastroenterologist to undergo endoscopy. Any obvious change in a wart or mole, obvious change means size increase or any itching is there, or suppose it is becoming going beyond the boundaries, if it is associated with the pain. So pain, itching and going beyond the boundaries in a wart or mole, you need to get a biopsy done by approaching surgical oncologist or a dermatologist. And patients with continuous cough, this is very important. continuous cough, and any change in the voice, which we call it as hoarseness of voice. These are all different kinds of symptoms which will signify different cancers in our body, which needs immediate attention. And what are all different causes for cancer? And this is basically a general discussion. So generally, how the cancer is caused in a male or a female, what are all the different risk factors that are involved. In this discussion, let us start with heredity. Hereditary transmission or hereditary involvement of family is very difficult situation. Mother, most of the times the cancers are inherited from mother. Paternal inheritance is very less. Most of the cancers are inherited from the mother. So how it is, there will be a basic gene which undergoes a particular mutation in the index patient. Index patient. Index patient means the patient in whom the diagnosis is established for the first time. Suppose if she undergoes that mutation, her daughters and her sons may get affected if they have the same kind of mutation. Like in the case of breast cancer, there is a specific gene which undergoes a mutation called BRCA mutation, BRCA. This mutation is very important, and this causes the cancer in children when the mother is affected in the early age. So this hereditary predisposition of cancers is very significant, and many cancers, not only the breast cancer, in uterine cancer it is applicable, in pancreatic cancer it is applicable, in thyroid cancers. If I label almost 30 to 40 cancers, more than 30 to 40 cancers are having this genetic predisposition. So familial history or a family history is very important in treating a patient with cancer. Next is immunity. The person's particular patient's immunity is not good. He will be attacked by certain specific viruses, which may cause cancer, which may cause different kinds of cancers called lymphomas and leukemias. And those viruses are, which I already told, they are Epstein-Barr virus, HPV. You may be knowing about it. HPV, human papilloma virus. HIV also can cause cancer. And bacterial bacterial causes for cancer, generally H. pylori, which will cause gastric cancer. And lifestyle, which I already mentioned, this sedentary lifestyle, having all habits like smoking, tobacco chewing, alcohol, and occupational exposure to certain areas, and wood dust exposure. These are all different kinds of causes of cancer. And physical variants means exposure to UV radiation, ultraviolet radiation, can cause skin cancers. So in this, it's very difficult to bring down all the causes in this 1 hour. I just briefly mentioned how the family predisposition, how the immunity of the patient, viral causes, bacterial causes, lifestyle changes, and occupational exposure, and all these physical exposures like UV radiation, ultraviolet radiation. The first important thing, what we have to modify the lifestyle is cut down the habits, like smoking. Smoking is root of the cause for many cancers. So if you stop smoking, that is going to bring down the incidence of cancer at least to 5 to 6%. So it causes many cancers, like not only the oral cancer, it can cause lung cancer, it can cause gastrointestinal cancers like gastric cancer, pancreatic cancer. Everywhere smoking is involved. So just stop smoking that is going to change a lot of shift in the incidence of cancer. So, in the recent past, there has been a lot of evaluation in India, prioritization of which cancers are more common, which cancers are less common. Overall, there is increase in the incidence of the cancer because of all the environmental pollution, food adulteration, habits, lifestyle. Apart from all the cancers, more common cancers in India, which have become more common than other cancers like breast, head neck, uterine, cervical cancers, women, and lung cancers. This doesn't mean that the other cancers are rare. Other cancers are also increasing the incidence, especially the esophageal, stomach, pancreas, and urological cancers like kidney cancer, bladder cancer, prostate cancer. All are on rise in India. So it is very difficult to discuss about each and every cancer in this particular 1 hour. So what I made is we'll be discussing about these more common cancers in brief. And I will just give a brief introduction about rest of the cancers for a small time after this. Let us think about the breast cancer. So this type of self-breast examination, these are the guidelines. The woman should do self-breast examination at least once in a month. They should approach physician once in 3 months to get clinical examination done. And from the age of 40 years, they have to undergo mammogram both breasts at least once in a year. Not only these three, they have any screening camps that are happening in our place. Anybody who knows healthcare personnel, they should be in regular contact with them. And especially the people with family history, they have to be very careful. And in those women, they have to undergo that mammosonogram both breasts. That is nothing but ultrasound both breasts. And this is recommended from the age of 25 years if there is family history. Suppose if the particular female's mother is affected with breast cancer, then she becomes the first degree relative who got affected with the breast cancer. So her daughter has to undergo this ultrasound both breasts from the age of 25, at least once in a year. And how the breast cancer is caused? There are different causes described for breast cancer, different risk factors described. Out of them, I have put some gist of factors here. It starts with family history. A woman whose mother got affected or sister got affected is very likely to get the breast cancer in future, as early as below the age of 40 years. So there is more than 90% chance if a family member got affected, there is more than 90% of chance that this particular female is going to get affected in future. So family history is very, very crucial in the case of breast cancer. And sometimes, most of the times, you may not be able to find any particular risk factor and the disease develops on its own. That I described it at last, that is called no specific risk factor. And certain other risk factors, early menarche, developing the menstrual periods are developed in the child. If suppose she gets early menarche at the age of 11, at the age of 10, they will be exposed to the fertile period for a long time. And late menopause, the cessation of bleeding, that attaining of menopause, if it is getting delayed also, that is also a risk factor for breast cancer. And a woman who avoids breastfeeding is at risk for breast cancer in future. So breastfeeding is a protective factor from breast cancer. So avoiding breastfeeding means you are giving the way as a risk factor for breast cancer in future. Nulliparous woman who doesn't have children, a married woman who doesn't have children, nulliparous woman is at risk for breast cancer in future. Usage of oral contraceptives, obesity, diabetes, all are described risk factors at a low percentage. And some women neglect presence of lumps in the breast. They keep it for a long time without any surgery getting done. For years together, more than 10 years, sometimes up to 20 years, they may evolve into breast cancer. So these are all risk factors mentioned for breast cancer. How breast cancer presents in a woman? It will present with as most common presentation will be lump in the breast. And it will not be associated with any kind of pain. A painless lump, which is incidentally detected in the breast, that is very significant symptom for breast cancer. It has to be evaluated immediately. The second is nipple discharge. Nipple discharge, especially bloody nipple discharge, is more suspicious. Nipple discharge has to be evaluated, and we have to take the smears of the discharge and send it for the examination. Especially bloody nipple discharge has got a very significant role in giving the diagnosis of breast cancer. Any kind of nipple erosion or a retraction also signifies the importance of breast cancer. Development of ulcer over the skin or the tumor or any swelling in the axilla, all these are symptoms of breast cancer. So if a woman develops any one symptom also, that particular woman has to be evaluated. So she approaches a physician or a surgeon or a surgical oncologist. The first and most important investigation that has to be done is mammogram. Mammogram growth breast, which I didn't mention here. Mammogram has to be done. Along with that, ultrasound both breasts also has to be done. That includes both the X-ray and ultrasound. In the mammogram, there will be a categorization according to the score, which we call it as a BIRAT score. And in ultrasound, there will be a correlation. So mammogram and ultrasound are what we've matched. And once radiologically and clinically we are suspicious, we will do this FNAC or biopsy from the lesion. This FNAC is going to give you the confirmatory diagnosis. And biopsy is even better. But most of the times, if the clinician feels the disease is operable, we can do surgery for the patient, FNAC is most of the times enough. Biopsy is not needed. But a preliminary mammogram and ultrasound has to be done, and these investigations are required. So why I am telling all these things is the knowledge about the mammogram, ultrasound, and this FNAC or biopsy is important for each and everyone, because they should know what the clinician is going to do when they approach a particular clinician. And these CT scans and PET scans are mainly done to evaluate whether surgery can be done or any non-surgical treatment has to be done or not. So it's a preliminary knowledge only. I'm not going into each and every detail which is needed for the all educated people and uneducated people also. The extent of the disease. Extent of the disease is also important. That is called, suppose if it is confined to the breast, treatment is, the patient is going to respond nicely. Suppose if it is spread to the distant organs, that is called metastatic disease. The confined disease is again divided into early disease and locally advanced disease. Early breast cancer disease has the survival that is equivalent to a patient who develops chest pain, undergoes a stents. Cardiologist put a stent, that patient will be living long, at least 15 to 20 years. Like that, the prognosis of early breast cancer is become. So, a woman diagnosed with breast cancer, there is no anxiety, no need of any anxiety. She'll have almost normal survival 90% of the time, but the diagnosis should be done early. I am talking about in relevance to early breast cancer. And a brief knowledge about what kind of surgery that is being done for a breast cancer. The surgery confined to lump and complete breast removal, these two things. And the role of chemotherapy is to facilitate surgery. The chemotherapy will be given either before surgery or after surgery. It's basically to facilitate surgery. So surgery is the definitive treatment for breast cancer, not the radiation or chemotherapy. They are only addendum treatments. This basic knowledge is important. So I told about the chemotherapy and radiation also. Most of the times, this will be given after surgery and chemotherapy. Hormonal therapy also given after surgery and chemotherapy. So these are four kinds of treatment for breast cancer patients. The first one is surgery, chemotherapy, radiation, hormonal therapy. So definitive treatment for breast cancer is surgery. Chemotherapy, radiation, and hormonal therapy all are addendum treatments only. And the woman who's diagnosed with early breast cancer, as most of the times, will be cured. Cure means she have normal survival. Locally advanced disease patients, among them 60 to 70% have a normal survival. Only the problem is with when the disease is spread to the other organs like liver, lung, and bone. These patients, the survival is not good. They will be given chemotherapy with a palliative intent, not with the curative intent. Curative means the patient is going to have normal survival. So it is very important to attend all the screening camps and should be well informed so that the diagnosis is made early in the stage 1 disease so that survival will be normal. Already the awareness regarding the breast cancer is very good. A lot of people are coming with early breast cancer and they are having good results after treatment. One more cancer I just wanted to briefly introduce you is head and neck cancers. It is basically a lifestyle disease. It includes oral cavity cancers, all the oral cavity, tongue, cheek, floor of the mouth, palate, and oropharyngeal cancers like tonsil, base of the tongue, and the throat. So all these cancers are related to the basically related to the usage of tobacco. If this one risk factor is modified, you can easily escape head and neck cancer. It's basically a lifestyle disease. Just modify this one, be very unlikely to get head and neck cancer. Other risk factors not so important as tobacco. Certain risk factors are described like intake of alcohol, and certain people will be having the sharp tooth. This is very dangerous. That will be constantly impinging on the tongue with repeated frictional action without any habit. In future, they may develop a tongue cancer. So this sharp tooth, if it is there, that particular person should immediately approach nearby dentist, undergo the smoothing of the tooth so that the edges will be smooth, not sharp, and there won't be any friction with the tongue, and they will be safeguarded in future from developing head and neck cancers. And one more virus that is very important in India, HPV, human papilloma virus infection has become rampant in India. But suppose in the case of oropharyngeal cancers, it has got significance, human papilloma virus infection. If it is positive, actually the prognosis is better in certain oropharyngeal cancers. So the most common tobacco products which are being used regularly in India, cigarettes, bidis, cigar, and chewable tobacco, pan and gutka, and some kini also. Some areas they use kini also. And the brief usage of these products is not going to cause any harm, but they will be chewing the tobacco for years together. Most of the patients will have this history of gutka chewing, pan chewing, and they will be having that habit at least for a decade, and they will stop. And when they come with the presentation of cancer to us, they tell that they don't have any habits. If we ask in detail what happened, we have stopped it now, but we have used it around 10 years back for a period of 10 years. So any repeated trauma to the layer of inside layer of oral cavity, any repeated trauma can cause cancer. So we need to avoid that kind of repeated trauma. It can be because of a tobacco product, it can be because of a sharp tooth, it can be because of alcohol. So you can't damage the integrity of the inner layer of the oral cavity and create the problems for yourself. Certain precancerous conditions. This knowledge is important for all the general public and society. Precancerous condition. There are many precancerous conditions described in the oral cavity, like leukoplakia, erythroplakia, submucous fibrosis. Like that, there are many scientific terms. I just wanted to briefly introduce you three conditions. Any whitish patch in the oral cavity. Suppose if it is there, you have to immediately consult physician or consultant and show your oral cavity to them. They will examine and they may take biopsy or plan some excision. But this is very important because this whitish patch is going to turn in future into cancer. This knowledge is important in the public. And any reddish patch. So I told about the whitish patch. Now the reddish patch is called erythroplakia. Actually, this is more dangerous than that of whitish patch. 18 times more tendency. 18 times higher tendency. 18 times higher tendency than that whitish patch to transform into cancer. So this presence of a reddish patch is more dangerous, and they have to immediately check it out. And the appearance of the inner layer, if it is becoming white totally, and it's losing its shine and losing its elasticity and shine, that condition is called submucous fibrosis. I just briefly wanted to introduce these three conditions to you so that you will be knowing what's happening inside. If you find those kind of situations, you will immediately alarm them to consult nearby physician. There are like this many conditions are described. I just wanted to introduce these three conditions to you. You should have the knowledge. Any whitish patch or a reddish patch or loss of elasticity of the inner layer is very, very significant. All this happen due to repeated trauma to the layer by putting something in your oral cavity and keeping it for a long time. That is a gutka, pan, all these things. And also smoking. So once the cancer develops, the clinician will do a small bit of take a small bit of tumor and send it for the histopathological examination called biopsy, and will do imaging. These are the treatment modalities: surgery, radiation, and chemotherapy. Here also, the definitive treatment is going to be the surgery. This radiation, chemotherapy, all are additional treatments. The surgeries for head and neck cancer are highly mutilating. Destructive surgeries, what I can say it is a destructive surgery. Sometimes we will be resecting a bone, sometimes we will be resecting a part, and we'll be filling it with a reconstructive flaps. So a lot of reconstruction procedures are being described for head and neck cancers. So surgery plays a vital role in head and neck cancer. And we are seeing a lot of change in the outcomes of head and neck cancer, how they are responding to treatment 3-4 years back, and now how they are responding to treatment at present. We are see the prognosis used to be good 3 to 4 years back for head and neck cancers after we operate. But now we are not seeing that much good prognosis. We are seeing some recurrences in the patients, and the disease is not responding to the treatment comfortably. This could be due to the tumor biology. And this is very important that head and neck cancers are also diagnosed early. Early diagnosis is the key. If the diagnosis is early, then you can avoid those mutilating or destructive surgeries, and we can have a better cosmetic outcome. So what I mentioned, complex resections and reconstruction. This includes different volume of resections. If I tell you, you'll be getting frightened the extent of how the resections are going to be. We'll be breaking this bone to approach inside the oral cavity, and we'll be resecting this particular bone, mandible, half of the mandible, and putting flaps there. So if you want to avoid all those resections, this diagnosis should be early disease, presentation should be early, and the only way you can prevent this head and neck cancer is not to go to the risk factors, not to touch the risk factors. It's a completely modifiable disease. And this one introduction I want to give is this robotic surgery. We put the instruments through the oral cavity and operate on the throat. This is a revolution for these oropharyngeal cancers. Suppose if I have to operate otherwise, I have to break this bone here and open this mouth like this and go inside and operate. All that is being stopped with this transoral robotics. Now, this is a revolution, and it is bringing a lot of improvement in the outcomes compared to the radiation treatment, which has been standard for these oropharyngeal cancers. So, future, it's going to be more and more applicable transoral robotic surgery. So, as I already mentioned, the risk factor modification is going to prevent most of the head and neck cancer. This is just lifestyle cancer. I'm talking about the more common cancers in India, and in women, the uterine and cervical cancers come next after breast cancer. So uterine cancer, most of the times, while screening, the physician will take a pap smear, put a scope inside the vagina and see the status of the cervix, and a small ultrasound, simple scan, ultrasound abdomen and pelvis. These three are screening investigations. So it's a simple. These are simple investigations. They don't take much time. They are not time consuming. Will be done in less than half an hour. All women who are having a family history or suppose a small symptom like bleeding for vagina, They should attend these screening camps, and awareness of these investigations is very important. Because if particular person knows what a doctor is going to do, then she can be more confident on that particular doctor. So for a uterine cancer, what are all the risk factors? How the cancer develops in the uterus? In which categories this is possible? Especially in the case of a postmenopausal woman who has completely stopped menstrual cycles. A menopausal woman, after the menopause, they will be having some spotting or bleeding the vagina. These people are at high risk for uterine cancer. Obesity, lifestyle risk factor. Diabetes, a lifestyle risk factor. Hypothyroidism. And one more thing I forgot to mention here is hypertension. Chronic hypertension is also a risk factor for endometrial cancer or uterine cancer. So don't neglect hypertension. It feels very simple, but it is very dangerous. So blood pressure control is very important. So hypertension, hypothyroidism, diabetes, obesity, and again the family history. This family history is very important in uterine cancers and breast cancers. Actually, most of the syndromes both are grouped together. Suppose if the mother is affected with the breast cancer, her daughter is going to get affected not only with the breast cancer or uterine cancer also. So that's how the genetic predisposition will be there, and it plays a very vital role. And each and every person should have the knowledge of family history. Suppose if their family members, one of the family members is getting affected, means they should go and immediately consult the doctor so that they will check all the gene mutations. Based on that, they'll get the clarity whether they're going to get the cancer in future or not. Suppose if there is the gene is positive in this person also whose mother got affected, then she can undergo prophylactic surgery, like undergoing bilateral mastectomy or undergoing hysterectomy before the cancer develops, and she can be tension-free. And in the treatment of breast cancer, this tamoxifen is being used. Sometimes it is being used for 5 years. And in some patients, we have seen the incidence of uterine cancer after prolonged use of tamoxifen. This is already mentioned. The only symptom with which the uterine cancer presents is bleeding from the vagina. It can be torrential bleed, or it can be occasional bleed, or it can be a simple spotting. In the case of a postmenopausal woman, this is very important to get evaluated. Most of the times, the advantage of the uterine cancer is most of the times, and most of the patients will be presenting with early disease. There won't be disseminated disease so common in uterine cancer. The basic investigations, biopsy means here, everybody should know what kind of biopsy they're going to take to confirm the diagnosis. That is hysteroscopic biopsy or dilatation and curettage, D and C, and hysteroscopic biopsy. So this is for confirmation, and imaging is for treatment. So I told about the risk factors, the symptoms of presentation, evaluation. If the patient has to undergo surgery, uterine cancer means uterus removal, ovarian removal, surrounding nodal removal. This is the basic surgery that is being done for uterine cancer. There are different approaches: open surgery, laparoscopy, and robotics. And laparoscopy, robotics both contribute to the keyhole surgery, which brings down the pain. Recovery will be quick, work resumption will be faster, less blood loss. All these things are advantages with the keyhole surgery that includes laparoscopy and robotics. Patients who undergo open surgery, they can't resume their work faster. They may have to take at least 3 to 4 weeks rest in the home before starting any work resumption. And they have to wear belts while taking stairs, all these things. But with minimal invasive surgery, all these things are not needed. And so prognosis is, as I already described, most of the patients present with early disease, and it is going to be good. Whatever the additional treatments, they don't have much role in endometrial cancer. They just are given based on the biopsy reports after surgery. The cervical cancer also the same. The pap smear, colposcopic examination. One more thing, important thing here is the clinical examination by the physician. Physician examination is going to play a key role. What are all the risk factors for cervical cancer? The poor hygiene, having HPV infection, multiple sexual partners, all these things are going to cause the cervical cancer. Some symptoms, basic symptoms like bleeding per vagina, any whitish discharge, back pain, or pelvic pain are the symptoms. So when these symptoms are there, we do a biopsy after doing a colposcopic examination and do a CT scan and plan the treatment. The surgery that we are going to do for this cervical cancer is called, there is a different name for a cervical cancer surgery compared to uterine cancer surgery. Uterine cancer surgery is called hysterectomy, and this cervical cancer surgery is called radical hysterectomy. These terms, if you know, you can ask your physician. And again, this has got three approaches: open, laparoscopy, and robotics. Robotics role is going to be key in certain cervical cancers and in endometrial cancers, which is not needed for you. But definitely, minimal invasive surgery role is there. But there are certain studies which are showing principles against minimal invasive surgery. But this has to be discussed with a particular physician when we are opting for open surgery or a minimal invasive surgery. Again, the early cervical cancer, if it is diagnosed early, it's going to have good prognosis. So these are all routine cancers which are more common, whose incidence has gone up in India. Certain other cancers like lung cancer, gastrointestinal cancers, if we come to the gastrointestinal cancers, it includes esophagus, stomach, pancreas, liver, colorectal cancers, and some urological cancers like kidney cancer, bladder cancer, prostate. There are many cancers, and each and every cancer has got separate risk factor evaluation, separate investigations, all kind of treatments. The treatment role, the treatment role has become very vital. Many more institutes are coming up with streamlined guidelines for oncology, and this is going to take over the healthcare to the next level. And especially in Hyderabad, the oncology units are so many, the treatment quality of all the cancers is being improvised so much. Almost it is even better than Mumbai and Chennai. And the awareness has also gone up. But still more, these awareness programs have to be improvised. And there are many apps regarding teaching, like mathematics, like Byju's. So I advise government to create an online app so that it will have all the information of oncology and everybody can access through mobile phone in that app and can get the knowledge and what are the treatments, what are all the screening programs, what are all the advances in the treatment of oncology. They can have the entire knowledge instead of going searching in the Google. Thank you.
Thank you so much, Doctor. Thank you for stressing a lot on the early diagnosis of all the cancers that are there. and the importance of early diagnosis. So before we move on to the question and answer session, I just want to put up a poll for everyone, all the attendees. I request everyone to participate in the poll. This will help us come up with a lot of interesting sessions going forward, and also to consider your feedback and make the sessions very informative and interactive. So we will take another 2 minutes, and then we will open the stage for Q&A, where the doctor will answer all your personal questions in regards to different cancers. Thank you so much. Thank you so much, everyone. Thanks for the responses. Waiting for all others also to participate. We have about 50% participation in the poll so far. Request all the other 50% also to kindly consider and give your valuable feedback here, please. Okay, thank you, everyone. We have about 74% participation in the poll. Thank you so much for your valuable feedback. Now we will open the stage for Q&A. Doctor, we have about 8 questions in the Q&A. I will read out to you. If you can answer them, it'll be great.
Yeah.
We'll do a mix of Q&A questions and also some live questions from the audience. Would that be okay, Doctor?
Welcome.
Yeah. So, Doctor, the first question we have is from Beulah Samuel. So I know it's hereditary, but what's the way to prevent, or does screening help?
Yeah, this question I answered in the presentation. Suppose if it is hereditary, so mother got affected with, for example, let me give an example. So mother got affected with breast cancer, and her daughter is there now. She wants to know whether she is having the hereditary variant or not. Mother has to be tested first for the mutation. That is called index mutation. And same mutation will be tested in the daughter also. Suppose if she has the same mutation, that means she is going to inherit either a breast cancer or uterine cancer in the coming future. That is going to happen 90% of the time. So certain women, they prefer to undergo a prophylactic surgery, preventive surgery. They may undergo both side breast removal, that is called bilateral mastectomy. You may be knowing about Angelina Jolie, she undergone it. And certain patients in our country are also preferring it, undergoing bilateral prophylactic mastectomy. They undergo hysterectomy also. It's a preventive measure from the development of cancer in the future. It's just quoting an example to understand.
Okay. So we'll take a live question now. Yeah. Mr. Damodar, you can unmute yourself and ask a question to Dr. Lakshmi Venkat Damodar. Can you hear us, Mr. Lakshmi Venkat Damodar?
Yeah, it's Lakshmi.
Please.
So recently, my brother confirmed with rectal cancer. The doctor suggested initially we need to go for radiation and with chemo for 5 weeks, and then based on the result, the surgery. So, is there any better options? And one more doubt regarding to this is my father generation, none of them has a cancer, but my grandmother has a uterus cancer. So is considerable as a hereditary? And one of the doctors suggested for me to have a colonoscopy too, because my brother and I'm the sibling. So I want to know on this area, sir.
Is your brother? Huh?
Yeah, my one brother. Yeah.
Yeah. So what is his age?
He is aging 42.
42. So
just 1 year back they confirmed after going all the tests.
Yeah. See, your grandmother has got uterine cancer, you told me. Huh?
Yes.
So if your grandmother is got uterine cancer, her daughters are more likely to get uterine cancer or breast cancer.
Okay.
And your father is not going to get affected because of your grandmother. And that's
Okay.
very rare. Okay.
Okay.
Now
Okay.
let us leave about that. Now let us come to your brother. So
Okay.
your brother is affected with rectal cancer.
Yes.
So his age is very low. At the age of 42, he has got
Hmm.
rectal cancer.
Yes.
So that means most of the times, if rectal cancer develops at the age of 40, they might have been having the predisposing condition from the age of 12 to 15 years.
Okay.
When their age is 12 to 15, they will develop that polyposis, which is
Okay.
called as a predisposing condition. And
Okay.
they have to undergo presenting at this age only, around the age of 40. That means
Okay.
your father, we have to check it out. Does he have any issues? And
Okay.
so better you undergo a colonoscopy. They will be doing once in 3 years or once in a year, uh,
Okay.
based on the initial colonoscopic findings. They
Okay.
will guide you.
Okay.
So you may have to be a little bit more careful and undergo a colonoscopy. And if suppose if that is normal, your physician will suggest you how frequently you have to undergo colonoscopy. That is
Okay.
one thing.
Okay.
For your brother, why they would have advised chemotherapy and radiation first, followed by surgeries? It might have been a locally advanced disease,
Yeah,
which
they mention it is a T3 state.
yeah, if you operate on a locally advanced disease, the patient will develop recurrence in future. It's
Okay.
always bring down the size of the tumor
Okay.
with some non-surgical treatments like chemoradiation, and you
Okay.
can do surgery after 8 to 12 weeks of completion of chemoradiation treatment, and
Okay.
those surgeries are going to give good results. If suppose if the tumor is very bulky, the prognosis is not going to be good.
Okay.
Suppose the tumor is reasonable small size, then the results are going to be good.
Okay.
Yeah.
And what may causes to get this, doctor? Any food habit? Because he don't smoke, he don't drink, even he don't take non-veg. So what might be the causes to get this?
Most of the times, rectal cancer will be caused by these risk factors. What you told: frequent non-veg intake, fried food intake, having altered bowel habit, all these things. But no risk factor identified means that doesn't mean that the particular person will not get rectal cancer in future.
Okay.
Without any cause, it is going that is more high part of rectal cancer causations. Okay.
Okay.
And this hereditary pattern is there in rectal cancer. So young age, at the age of 42, rectal cancer means you have to evaluate family members.
Okay. Okay. Thank you, doctor.
Yeah, I think your questions are answered, Mr. Damodar. So,
Yes. Yes.
thank you. We'll take another question from the Q&A, Doctor. So, Uma Mallari says, hello, sir. Good afternoon. My mother is diagnosed with endometrium carcinoma and undergoing treatment. And is there a chance to detect the occurrence in us, her children, upfront?
Her mother has got affected.
Yes, doctor.
So endometrial cancer is nothing but uterine cancer only.
Okay.
And so if they mother has undergone treatment, what is her age? That is also important. And suppose if they know, they have to know whether they are going to inherit this cancer in them or in their children or their siblings. First is, I already told you, one mutation is there called BRCA, BRCA mutation. And there are certain other genes also that have to be tested. You have to consult these genetic physicians so that they'll get the full length of genes tested. And suppose if any detailed gene mutation is detected in your mother, you have to undergo the same gene mutation in you also. If suppose both of you got the same mutation, you are going to inherit that particular cancer in future.
Understood, doctor. Thank you so much for that. So we'll take another live question. Sharmila, if you're online, if you can hear us, please unmute yourself and ask your question to the doctor. Sharmila Behuria.
Yes, hello, doctor.
Yeah.
Yes, I wanted to know, like you're saying, no, if it is early or late. So, what is the right age for menopause, and what is the right age for this menarche? Like, I believe, and during my age, it was like 15 years when I remember when I was in my 9th standard. So, but now I see, like, even 12th standard, what you say, when the 12 years old girl is getting. So, what is right? What is early and what is late here?
Menarche. Regarding menarche, you are asking.
Yes, and menopause as well.
Yeah, menarche, suppose if it comes at the age of 10 years, we consider it as early menarche.
So what do you say? It is good or it is bad?
That's what I told. Early menarche is one of the risk factors for development of breast cancer.
Okay. Yes.
And late menopause. Late menopause. That is, generally menopause comes around the age of 45 years.
Okay.
Around 45. Suppose if the woman is not getting the menopause by the age of 50 also, that's the risk factor.
Okay. So this, you say 45 and 50 is the ideal age they have to attain that.
2-3 years around the age of 45 is okay.
Okay. Well, like 55, because I don't know what pick up. My parent, at least my mother, she had sometime in 52 or 53. Okay, but no, I'm just saying because I've checked with my friends, they say, when you attend that, you should take a lot of care, you should do this. But I did not notice any such with my mom.
Okay.
Yes, because she said they'll have some mood swings, they will have, she was explaining me all that. Then I said, okay, I am observing, but I have not seen all that.
Now, what is her age now?
And now she's 62.
62?
Yes, 62.
Okay. She attained around the age of 50?
Yes.
Okay. See, already her age is around 60 to 63 years. You may have to closely watch for any symptom for bleeding from vagina, bleeding per vagina.
Okay.
There's some spotting also may be there.
Okay.
Has to be given significance.
Okay.
Better is to get one check ultrasound. It's a basic scan only. Done with a good consultant. If that is normal, you can just relax.
Okay. So even 52 is fine, right? There is no harm.
52 is considered a delayed menopause.
Okay, fine. Okay. Okay, then. Thank you.
Yeah, I hope your questions are answered, Sharmila.
Yes.
Great. So we'll take another question from the Q&A. Dr. Elizabeth says, what if the paternal side has affected cancer cases in the family and the maternal side mother has none? Is the child safe or has higher chances of getting the illness?
Okay. Most of the paternal side inherited cancers, include colorectal cancers, large intestine cancers, large intestine and rectal cancers.
Okay. So
other cancers are unlikely from paternal inheritance.
Okay.
Because these head and neck cancers, lung cancers are not inherited paternal.
Understood.
You got
yes, doctor. It's a Q&A. So I hope if they're not clear, they can raise their hand and they can talk to you directly. Yeah. So, doctor, there's another question. It's from an anonymous attendee. It says, is leukemia different from cancer? Why are hospitals not providing proper awareness to the family or patient before starting treatment?
Yeah.
Even when the cancer is in fourth stage, why do we proceed with treatments?
So here two questions are there. One is regarding leukemia and fourth stage of the cancer.
Okay.
So leukemia is considered, it's a different kind of cancer. The cancers are divided into two types, solid organ cancers and liquid cancers. All these cancers I described are solid organ cancers. Leukemia is considered as a liquid cancer. It's a blood cancer actually. Leukemia, another term is blood cancer. And it will be dealt by a separate physicians called hemo-oncologists. We have the team here, bone marrow transplant team, and they deal with this leukemias. General term for this leukemia is blood cancer. It will be dealt by hemo-oncologist, and leukemias now, certain leukemias are having good prognosis with treatment, they're responding well, and there are multiple treatment options available, but the end treatment option for a leukemia is a bone marrow transplant. And we have a big team here who can help them now. And one more thing is, you asked, it is fourth stage cancers. That's what we are spreading the knowledge. Get the cancers detected early, not at the late stage. So how the symptoms for a late stage cancer, for example, a breast cancer, let us assume a breast cancer patient. With the symptoms I mentioned are only for early breast cancer. Suppose if the same patient is having shortness of breath or any cough with blood or any bony pains, then there can be fluid in the chest. There can be metastasis, disease has spread to the lungs, or disease has gone to the bones. These are all different symptoms which will quantify the stage of the disease. That is fourth stage cancer. That is called metastatic disease.
Understood, doctor. Thank you so much for that answer. We will move to the next question from Sushila Mendonca. She says, are uterine fibroids at risk of turning cancerous? Can one do a PET scan to rule out the cancers even if there are no symptoms? Do IUDs cause uterine cancers? Why is chemo continued even after a lump is removed completely?
So a lump is removed completely means from where?
She did not mention that, doctor, but yeah, if you want me to repeat the question, doctor?
Yeah.
So it says, are uterine fibroids at risk of turning cancerous?
Let me answer this now.
Yeah.
So uterine fibroids, most of the times they won't cause cancer, but if they are allowed to grow to abnormal size for a prolonged duration, that is more than 20 years, they are likely to change into different types of cancers called sarcomas. So it is advisable for women with uterine fibroids, if they grow more than 3 to 4 centimeters, but best is to undergo surgery and getting them removed. Yeah, next question. Same. Can you continue the question, please, Shiva?
Yes, doctor. Yes. And say, can one do a PET scan to rule out cancers even when there are no symptoms?
Yeah, and suppose if the woman is more apprehensive, if the patient is more apprehensive, then we can get a PET scan. There is no harm in getting PET scan done.
Okay. And she says, do IUDs cause uterine cancers? No.
Intrauterine deaths won't cause any cancers in future.
And also she says, why is chemo continued even after the lump is removed completely? And I see her, she replied, it's axillary.
Yeah, mostly she will be talking about the breast cancers and axillary dissections. So breast cancer is considered as a systemic disease. That means it involves the entire body. Not just mere removing the lump is not going to complete the treatment. If you give chemotherapy, it is going to address that systemic disease completely. This is going to bring down the incidence of recurrence in future. That's why we give chemotherapy even after removal of the lump.
Understood, doctor. So Shivacharan Reddy says, is lipoma is related to cancer?
Lipoma is not a cancer. Lipoma is a benign tumor. I just showed a picture where it was like a ball in case of a benign tumor, and in the case of malignancy, the cells were exfoliating outside the boundary. So it's a benign tumor, lipoma. It's a fat tumor. It's harmless. But certain exceptions are there. Suppose if this lipoma is in the shoulder area, nape of the neck, trunk, back of the trunk, thighs, in the thigh region. So 4 areas you have to be careful: shoulder, nape of the neck, back of the trunk, thighs, and in the within the abdomen, retroperitoneum. These 5 sites are more dangerous. They may turn into cancer in future.
Understood, doctor. Thank you so much. And we'll take one last question from Mr. Praveen Reddy Gajawada. He says, my cousin's baby boy born with left side undescended testicle.
Okay.
When baby boy undescended testicle was outside of testicle, after 10 months, it reached the scrotum sac, but not descended completely.
Okay.
Baby gone with surgery for this at 11 months of his age.
Okay.
I heard that undescended testicle causes testicle cancer. As we gone with the surgery, is baby completely safe? What are the precautions that should be taken?
Yeah. This surgery might have been done by a pediatric surgeon. Undescended testis in a child, it's a common problem. It is totally not related to any cancer in future.
Okay.
So the child is totally free of getting any cancer in future. Only the neglected undescended testis that is lying within the abdomen and pelvis, and that is not being addressed, and it is within the abdomen, and child has become adult, that the undescended testis is within the abdomen, even in that adult, that kind of undescended testis is going to develop cancer in the future, not the other situations. So your child is comfortable, no problem.
Okay. Doctor, there's one person who's asking a specific question. If you're okay, I want to bring it up.
Yeah.
Mr. Venkatesh is asking, doctor, that he's suffering from gastric related issues from a while, unable to eat food outside or spicy food, been taking medications to reduce this. Would please like to know if this is a serious issue, how to stop gas forming in stomach and also prevent it from becoming serious like gastric cancer.
What is his age?
Venkatesh, if you're here available in the session, you can also come online and tell us your age, or you can just type 24, doctor. His age is 24.
For his very young age, probably what are all the symptoms he mentioned, were mostly lifestyle disease. What are all the things he mentioned are lifestyle related. He might not be having the food at the right time.
Okay.
He might be eating at a evening around 4 o'clock or 5 o'clock and late nights. And probably if the particular Venkatesh is software professional, he maybe is not sleep in the night, good sleep in the night, and work stress. And in addition to all these things, having junk foods like all these KFCs, McDs, Pizza Huts, all these things. All this contribute to this problem. First, you modify whatever the risk factor that is getting connected to you. You modify that, all these problems are going to go down completely.
Understood, doctor. Doctor, there's another question from Keegan D'Souza. He says, my daughter had a tumor on her shoulder when she was born. It was removed at 2 months and the biopsy ruled out this as a chondria syngroma.
Okay.
Do we need to take any precautions for future?
Yeah, regular follow-up is important with the surgeon.
Okay.
What is her age now at present? I don't know. She underwent when she was born. What is her age at present?
13, doctor.
13. It's already 13 means she underwent at the time of birth, no? At the age of 2 years, probably.
Correct.
Yeah?
Correct.
So they need not worry. But they have to be in follow-up with the surgeon.
Okay. Understood.
Already more than 10 years, that means it's cured.
Yeah. Thank you so much, Doctor. Thank you for spending your valuable 1.5 hours with us, clearing all our doubts, and thank you so much for presenting the information. It is an eye, I'm sure it will be an eye opener to all of us, and we will start taking health seriously and going for regular checkups at least every 6 months, and make sure that we are healthy and we are, following all that is required to bring the number of cancer cases down in the country. Thank you so much.
Thanks all of you for giving me this opportunity on this World Cancer Day, 4th February, to enlighten all of you. It's a great opportunity for me. Thank you, Shiva. Thank you so much.
Thank you. And everyone in the audience, we are coming up with another session next Friday on sustainable living. I am posting the link here. You can register directly on the session. Thank you so much, everyone.